Hey guys, I'm sitting in the dental chair in my office with my hygienist of the day, Jessica. So we had a patient that had to change her appointment. So I got put in the chair because, in all honesty, I'm way overdue. And I'll show you. There's my charting. So some bleeding points. I like to show people that because I'm human, and even though I'm a dentist, I still have issues with my gums, and I own my gum disease. So anyway, I am going to do something that I talk about, and I've done this test probably 10 times, and I'm doing it again just to see what these bleeding points contain as far as bacteria. So here's how we do it. I'm just going to do this. I should do this Facebook Live. So this is like the little test tube. This is a test we call oral DNA. And we talk a lot about oral systemic links. We talk a lot about the book, Beat the Heart Attack Gene. It's as serious as a heart attack, seriously. And all of these things can be prevented. So what does that mean? Well, it just means that what we get as far as information out of this test tube will help us treat my gum disease. Gum disease is linked or can be linked to heart issues, stroke issues, diabetes issues, okay? It's all about chronic inflammation. So it's kind of like, is what I say, we have, let's say in the heart arena, a medical condition with a dental solution. And the dental solution is getting the bacteria, the pathogens down in your own mouth, okay? So anyway, I'm gonna do this, so.
Switch for 30 seconds. A little longer. Ten more seconds. Okay, go ahead.
Now, I know for some of you with a weak stomach, that just grossed you out. But that was just like a mild saltwater rinse. So all the bacteria get collected, and basically I spit them out in that test tube. I'm going to do 3 tests. And it's 3 tests that I tell all of you to do, which is my perial path. So we look at the bacteria. The second one is going to be a DNA test called Celsus 1. So we're going to look at different DNA factors as far as my inflammatory issues that I might have, and then connections with possible heart disease, stroke, and diabetes. And then the third one is HPV, that we commonly do HPV. I know I'm negative for that, at least at this stage. And what I'm going to do instead of the HPV, I'm going to do the new Candida test. So it's Oris Candida. And again, these are all by Access Genetics. We call it oral DNA, but Access Genetics is the lab. And that kind of begins the process to really fully understand where I'm at as far as my stage of helping myself and my periodontal disease. So the next thing I'm going to do is basically sit back. I'm going to get my noise reduction wireless headphones, my Bose, rock out while Jessica takes care of my gums using a laser-assisted therapy along with microsonics, all of which we'll talk about at another date. Maybe I'll even do a blog about it. But there you go. That's how I do my salivary testing for oral DNA. Make it a good day. And this is Jim from McCreight Progressive Dentistry.